In December 2019, in Wuhan, China, people began to fall ill from a mysterious virus. This virus was quickly determined to be the SARS-CoV-2 virus. It began to spread rapidly across the world, and it became apparent that we needed to develop a vaccine right away. However, the fastest a vaccine had ever been developed was 4 years for the mumps. But in December 2020, Pfizer and Moderna both released a vaccine. So how did we do it? Money was a major factor. Vaccines can cost hundreds of millions to billions of dollars, and even then, only 6% of preclinical vaccines make it to market, making it exceptionally risky. Companies offset this risk by developing vaccines slowly and carefully. However, through fiscal stimulus by governments around the world, companies were able to speed up development through areas such as nonlinear clinical trials. In addition, when performing clinical trials, companies generally utilize a longer study period to increase statistical significance of their results. However, due to the massive numbers of COVID-19 infections, companies were able to increase their sample size, increasing their study significance, allowing for shorter timelines. A major part of both of the currently available vaccines is that they utilize mRNA. This is advantageous as we can use reverse transcriptase to develop cDNA, which we can store and then rapidly transcribe to make large amounts of mRNA in a fast cell-independent process. This is quicker than the traditional attenuated viral vaccines, as this method is reliant on cell division, which is relatively more time-consuming. In addition, the SARS-CoV-2 virus is part of the coronavirus class of viruses. Our previous knowledge on this type of virus allowed us to decrease the normal 5+ years of basic research which is required for vaccine development. In addition, databanks created by organizations like the WHO and CDC allowed scientists to work together to perform this research rapidly. A big question that we should start to ask ourselves as the pandemic nears its end is how we can repeat the COVID-19 success. A big problem for repeating the success is that the COVID-19 vaccine may have been destined for this success. Comparing it to the recent Zika epidemic, which still lacks a vaccine, we can see that prevalence in first world countries encourage massive fiscal stimulus that can't always be expected. In addition, the SARS-CoV-2 virus slowly mutates with only 2-point mutations a month per genome, which is half the rate of the common cold and a quarter that of HIV. Although it may have been destined for success, that doesn't mean we didn't learn anything from the pandemic. This pandemic has shown the importance of creating free access databanks so scientists around the world can share information on any new viruses. And in addition, this pandemic has highlighted the importance of the scientific community educating the public to instill trust in the science that protects us. If we utilize what we've learned from this pandemic, we might be a little more ready for the next world-stopping one.